Hey everyone, in this video I'm going to give you suggestions on how to treat pediatric patients in the hospital. Being an emergency room nurse now for a few months, I've treated many pediatric patients, and in this video I want to share with you guys what I have learned from helping them out. In this channel, I talk about all aspects of nursing. If you want to learn more about nursing, consider subscribing as I upload a video every week. Also, be sure to give the video a thumbs up if you found it useful, as it helps others see the video as well. Prior to working in the emergency department, I had never really treated pediatric patients in a clinical environment. However, as some of you may know, I used to work as a medical office assistant for a few years, and so pediatric patients were not completely new to me, especially at the clinic I used to work at, as there was a family physician who specialized in pediatric care. But treating them in the hospital, where you have to perform pretty invasive procedures, can actually be quite challenging. However, now that I've been working in the emergency department for a good chunk of time, I think I can provide some insight on ways to better provide care to these patients. Oh, and before I begin, like I mentioned, I'm not a pediatric nurse, so all you pediatric nurses out there, don't throw shade. With that being said, let's get on with our first suggestion that I have for treating a pediatric patient, which is to make yourself eye level with the patient. Try to make yourself as small as them and either sit or kneel down. For instance, don't stand up while they're sitting. Doing this will provide them with a lot more comfort when you're speaking to them, and they feel less intimidated. This is especially the case for children that are within the age range of 2 to 10. So the first thing I do when I go into a patient room is to sit down and try to make myself smaller. When I do this, I almost immediately notice that the child is a lot less afraid to be playful with their mother in the room, and you can just tell that they are a lot more comfortable and more willing to interact with you. The second suggestion I have for treating pediatric patients is to compliment what they're wearing. This works for pediatric patients of all ages, really. I always try and establish a good rapport by complimenting their shirt or what they're holding. Doing this creates a conversation that does not intimidate them. Often children are more likely to open up if you talk about something they like or something they're wearing. They are always taught at a young age to be polite, and this kind of opens the room for a conversation and just makes them feel a little bit more comfortable overall. The third suggestion I have is to establish a good connection of touch. The way I typically do this is by explaining to them what needs to be done and ending the statement by asking them to give me a high five. For instance, if I have to give some oral suspension medication like acetaminophen or ibuprofen, I tell them, I need to give you this to make you feel better. Do you think you can do that? I think you can. You seem very strong. And then I ask them to give me a high five. And then when they come in to high five me, I always shake my hand. I'm like, oh wow, you're so strong. You hurt my hand, you high five me so hard. Doing this does multiple things. The first is it establishes a sense of trust between you and the child by telling them exactly what's going to be happening. It also ends the conversation by making them feel like they're really strong, complimenting them, which makes them just much more likely to do what's being asked. Another suggestion I have is to reward them after by saying something along the lines of, after you have this medicine, you get to go to school and have fun with your friends. Or in my hospital, we have ice cream that we give children. So I always say, after this, if it is okay with your parent, you can have an ice cream. What's your favorite flavor? Using reward for action has also been very successful in providing great care for these patients. The last suggestion I have is to tell the child and show them what is going to happen. Sometimes for reductions or for suturing children, we often have to sedate them so that we're able to safely perform certain procedures. In those cases, we often give them either an injection of ketamine, or more commonly, we have to give them intranasal ketamine or midazolam. This requires significant cooperation from the child, but explaining to them why we need to do these certain things will provide them with trust between them and you, which is super important. So I always give them like an injection syringe without the needle in there. And I also give them an intranasal ketamine syringe with the nose tip on top that's empty, and kind of show them what that device is used for and how it works. Giving them time to play with the equipment makes them a little bit more comfortable when you're performing a certain procedure. So there you have it. Those are a few suggestions I have for providing care for pediatric patients. And again, I work in the emergency department, so I may not be as experienced as a pediatric nurse, but those are some of the things I have learned during my time. I would love to hear any suggestions you may have, or if you're a pediatric nurse and have any suggestions for me or other nurses, let me know in the comments section down below. If you found this useful, please don't forget to give the video a thumbs up, and thank you so much for watching, and I'll see you in the next video.